Hi, I'm Mr. Otway here with your last History Revision podcast, and this time we're looking at the history of surgery. For this exam, subject knowledge is important, but not as important as your ability to analyse a source. Unlike the American Western medicine exams, you'll not be asked to simply regurgitate knowledge, but you must have knowledge available in your brain to help you to understand the sources that end up in front of you during the exam, and to help you write really clever things about them. You must use quotes from the sources provided in all of your answers on this paper. But in order to prepare yourselves properly for this exam, there are 3 things I would advise. 1. Get out any old surgery exam papers that you have attempted in the past and read your answers before looking carefully at the targets your teachers have given you. 2. Read the mark schemes and the examiner's reports from past papers. You could use the link on the website above this podcast. 3. Use the sheet that is at the very top of this web page titled What to Expect on the Exam, in which there are suggestions on how to answer the questions. Memorise it. It would be useful if you could combine all 3. Why not try to memorise the What to Expect on the Exam sheet, look through your old targets, then attempt a past paper before reading the mark scheme and the exam reports to see how well you've done. That's what I'd be doing anyway. Now on to some subject knowledge. There were 3 major problems with surgery in the early 19th century: blood loss, pain and infection. We'll look at all 3 individually and consider some key individuals and inventions. First, pain, as this was the first problem that surgeons managed to tackle. William Morton is the first individual of note. He was an American dentist who, after 1846, began using ether on his patients, which led to others copying him, as patients would feel no pain during an operation. Unfortunately, ether was also quite troublesome, as it often made patients vomit. It irritated the lungs, making even unconscious patients cough. It was highly flammable, and as it was being used at a time when candles and gaslights were the only forms of artificial light, it was a bit dangerous, and it could put patients to sleep for days. Fortunately, James Simpson was to experiment to try to find a better anaesthetic, and in 1847 he discovered that chloroform was as effective as ether, but without the same problems. It did have one huge problem though, and that was that sometimes people died after taking it, until John Snow invented an inhaler that would measure the dose properly and ensure that it wasn't deadly. Queen Victoria herself helped to make chloroform popular when she took it during the birth of her 8th child. Anaesthetics provided the first major surgical breakthrough, but many surgeons refused to use them. There were a number of possible reasons why a surgeon would not use anaesthetics, ranging from a religious belief that God made us feel pain for a reason, and we shouldn't stop it. Perhaps because the surgeon didn't trust anaesthetics. Or perhaps they felt it was easier for a patient to die if they laid still rather than struggling. And most importantly, some surgeons refused to use it because they noticed that the death rate actually did go up with the development of anaesthetics. This was because as operations could go on for longer and go deeper, due to the patient not struggling or feeling any pain, blood loss, and in particular the issue of infection, ended up causing more deaths, which didn't help people to accept the use of anaesthetics straight away, important development though it was. The second problem for which a solution was found was infection, which had become a huge problem after the development of anaesthetics. Surgeons did not see the merits of hygiene, and some had aprons covered in old pus and blood, which was the mark of an experienced surgeon. Ignaz Semmelweis was an Austrian doctor who successfully reduced the death rate in a Vienna hospital in 1846 by making medical students wash their hands with a chlorinated solution before they went and helped with childbirth. However, he was laughed at for his new standards of cleanliness and eventually sacked from the hospital. The publishing in 1861 of Pasteur's germ theory was the catalyst that kick-started change, and Pasteur influenced Joseph Lister, who in 1865 began to experiment with carbolic acid during operations. He found that it was an effective antiseptic, and though it took until his appointment as Professor of Surgery at King's College London in 1877 before his ideas really caught on, that's 16 years after he first discovered it, Lister's invention or discovery of carbolic acid was something that saved many lives. However, just like anaesthetics, antiseptics were not always used by surgeons straight away. In this case, some surgeons might decide not to use it because it covered everything in acid, making the operation more difficult, made things slippery, and it cracked the skin of the hands of the people who were involved in the operation. The equipment was also heavy and expensive, and using carbolic acid also slowed down the operation, which made the problem of blood loss worse. So, Lister came up with a key invention to help prevent infection during operations, and we've talked about chloroform, which helped with pain, but there was still, by 1877, still the problem of blood loss. It should be noted that as it drew to a close the 19th century and moved into the 20th century, there was also a move away from antiseptics to aseptic conditions, which basically means making sure everything in the room where the operation is taking place is as clean as possible so germs are not there. Early attempts to deal with blood loss involved cautery, which means burning a wound shut to stop it bleeding. A pretty painful solution, and it would leave terrible burns that would often become infected. In the 16th century, Paré developed metal clips for arteries and used silk ligatures to tie blood vessels after an amputation. People also experimented with blood transfusions because they didn't understand that blood was different in animals, they tried to use animal blood, which usually meant the patient died. It wasn't until 1901 when Karl Landstein identified that there were different blood groups. That was the first serious breakthrough, but it didn't come till the early 20th century. He showed that for blood transfusions to work, they had to be done between people with the same blood group. A big problem that still existed, though, was that when Landsteiner first made his discoveries, the blood donor had to be in the room next to the person receiving the blood. There was no way to store blood and keep it fresh. The First World War meant that more people were at risk of bleeding to death. That started in 1914. After that point, there was a real drive to find a solution in how to store blood. And by 1917, the first ever blood bank was established at the Battle of Cambrai. So by 1917, there were solutions to pain, blood loss, and infection. There are two further bits of subject knowledge that you should be aware of. One is the role of technology in the development of surgery, and the other was the role of war. We'll look first at war, and the First World War in particular. We've already discussed how it had an impact on the development of solutions to the problem of blood loss, but it also had other impacts. For example, the war produced hundreds of thousands of casualties for surgeons to operate on, usually under extremely stressful conditions and without the luxury of a hospital room. That meant that surgeons often had to improvise and experiment, and though things would often go wrong, occasionally new discoveries were made in different surgical techniques. Head injuries were fairly common, and though brain surgery was not really tried before the war, during the war, soldiers with serious head injuries were probably going to die anyway, so surgeons tried to operate on them to save them. In this way, brain surgery began to develop due to the war, though it didn't develop very far. Perhaps the most famous development of the First World War in terms of surgery was that made by Harold Gillies, who set up a plastic surgery unit in the British Army and tried to help injured soldiers to look relatively normal again. His greatest success came with the use of pedicle tubes. A final development stated in the textbook that is related to surgery and war came with the development of prosthetic limbs because so many men lost limbs during the war. Technology is another factor that had a significant impact on the development of surgery. For example, chemistry was vital in the discovery of anaesthetics and in finding ways of storing blood effectively, in addition to the development of carbolic acid, all to do with chemistry. Technology also helped to prevent deaths in other ways. For example, John Snow's invention of the chloroform inhaler prevented overdoses, and X-ray, invented by William Röntgen in 1895, was arguably one of the greatest medical breakthroughs of all time. So in just one podcast, you have an overview of the subject knowledge that you will need to do well in this exam. However, I cannot stress enough how important it is for you to focus on exam technique for this exam. You will need to use quotes from the sources to support all of your answers, but for full details on how to answer each question, use the what to expect on the exam document and memorise it. I've been Mr. Otway, last hurdle, last big effort, good luck, and I'll see you to shake your hand on results day.